Welcome back, and hope you all managed to have a decent break then. So this is our first panel session, and we're looking at employment and mental health and an unequal landscape. I think we all know that inequalities throughout the pandemic have increased both locally and nationally. So we're going to hear from some experts around this. Please start to ask questions through the chat, and we'll address those. There'll be time at the end of all the speakers for them to answer some questions. So please do keep questions coming in. So first of all, I want to introduce you to Emma, who is the Head of Workplace Wellbeing at National Mind. Welcome, Emma.
Hi everyone, my name is Emma Mamo and I'm Head of Workplace Wellbeing at Mind, the mental health charity, and I'm very privileged to be part of the Wellbeing at Work 2021 Covid and Beyond conference being held by Mindful Employer. Today, I'm going to be talking about COVID, the impact it's had on people in work, UK workplaces, and just trying to reflect on the fact that it has had an unequal impact on us all and impacted certain groups in different ways. I think it's safe to say that we've all been in the same storm, but a different boat. So really looking at that and some of the key trends we are seeing, and then reflecting on what employers need to be doing in response to that. So, thinking back to a year or so ago, when the pandemic was just starting, when the first announcement by the Prime Minister to work from home if you could, and then the restrictions we were seeing on our lives, at Mind, we were, of course, reflecting on, well, what will this mean for people with mental health problems, and what will we as a national mental health charity need to do in response? What will people's needs be? But at Mind, we always want to be insight-led, so we did do a survey from April to May during the lockdown period last year to really understand people's needs, and I'm going to be talking about that in a moment. But instinctively, at the start of that period, we could of course see that the outbreak was going to cut across all areas of our well-being. It would of course impact on our physical health, our financial well-being, our social well-being, and of course our mental health. Thinking about the impact it might have on individuals, it was of course acknowledging that that would be quite varied and probably in multiple ways for the same individual, but maybe at different times. And I can certainly reflect that for myself, a real roller coaster of emotions, day to day, week to week, and just having to manage that. Thinking about the impact on our mental health, of course, it is the health anxiety that goes hand in hand with a global pandemic such as this. It was, of course, the uncertainty that it was presenting, the economic impact of it, the restrictions being placed on people's lives leading to isolation, but also more broadly, limiting our access to the things that keep us well. And then, of course, the great loss of life that we've experienced, so bereavement and indeed trauma that goes with that, especially thinking about frontline workers, because, of course, they are dealing with patients and their family members, but also the great loss of life they're experiencing amongst their colleagues. So those were some of the things instinctively we would think we will be seeing. But in terms of that survey that we ran for the first lockdown period from April to May, we had around 16,000 respondents take part. The majority of them, around 80%, had previous lived experience of mental health problems, but the rest of respondents were just taking part and sharing their experiences in terms of the pandemic and what it had impacted on their mental health. What we found, though, is across those 16,000 people, 60% of adults and 68% of young people said their mental health had got worse during that lockdown period. When we looked in detail, parents and respondents from the BME community were more affected by concerns about work. Women were more disproportionately affected by the coronavirus restrictions and perhaps shouldering more of the child caring responsibilities, so finding that challenging to balance alongside work. When we asked people who had experience of mental health problems and would normally be seeking support from services for their mental health, whether or not they felt comfortable to do so during this time, we found that around a third of adults were saying that they didn't feel that their problems were serious enough to seek support during this time because of the concerns of how much the NHS was being put under strain. But obviously we've been trying to say to people, if you need support for your mental health, do still reach out to services, they are there. We found that people were employing some potentially unhelpful coping strategies, either drinking alcohol, eating too much or too little in order to cope. we found that 18 to 24-year-olds were using much more negative coping strategies and were struggling to access support, so self-harming and using recreational drugs and so on. So that gives you an insight in terms of people's mental health during that first lockdown, and I'll talk a bit more about the subsequent lockdowns in just a moment. But looking at the key factors that were affecting people's mental health, it was, of course, not being able to see people that you don't live with, not being able to go outside, anxiety about friends and family getting the virus, feeling bored or restless, and then feeling anxious about getting the virus yourself, loneliness, and so on. And then obviously the difficulties of buying food and essentials during this time, and then concerns about work. I think to reflect on 2020 more broadly, there's of course the impact of the pandemic, schools, education, and what impact that would have on children and young people, and by extension their parents, and the issues around the school results and so on. Again, a broader impact of the pandemic is the NHS on pause, so not being able to access treatment or operations and other things being pushed back. George Floyd, and then the increased prominence of the Black Lives Matter movement in response to that, and really highlighting issues around race and institutional racism in the UK, and of course causing some much needed conversations within organisations about their approach to this issue. And then thinking about growing divisions, obviously they had Brexit, we had a rise of transphobia, and government policy on these issues didn't go as far as many people wanted. So although we had seen quite a lot of togetherness and unity in response to the pandemic, and clap for heroes, Joe Wicks doing his PE lessons for working parents, I think we also need to recognise that last year there were also growing divisions across our communities, and reflecting on that. And then of course the ongoing concerns about climate change. So just to reflect on last year more broadly, it is around people experiencing a lack of control in their lives and those around them, high levels of distress and trauma, some of it linked to the pandemic, some of it linked to other issues and events. So just reflecting that it was a tough year overall. Where are we now? Well, of course, we've had numerous local and national lockdowns across the 4 nations during this period, the tiered systems, a lot of uncertainty, a lot of rapid changes from government for businesses and people alike. We know people have been living with existing pressures during this whole time, so caring responsibilities, exposure to negative news and what impact that has. Obviously the impact of winter, darker and shorter days with less sunlight, so impacting on our sleep rhythms and on our mood. And of course flu season, again having an impact for frontline workers more broadly, as well as the pandemic. Increased concerns about isolation and loneliness. So the Office for National Statistics have been tracking the social impact of COVID during this time. And in November, when we really did move into those shorter days, they shared some data around 8% of the population reporting acute loneliness. So around 4 million people. Prior to the pandemic, it had been at a level of about 5%. And then they also shared that around 2.6 million people, I think, had not left the house, had not left their home in the last week or so. So again, concerns about loneliness and isolation. Obviously, the concerns about the economic impact of the recession and those sectors and industries hardest hit. Concerns about at-risk groups, so young people being much more impacted by the social restrictions. I already noted women, but again, juggling home and work responsibilities. And I guess it's just the unknowns about the future. I mean, we had the announcement a week or so ago about a roadmap out of the toughest restrictions, but again, we know some of that may shift. But as we come into a period where it might be transitioning out of this, that of course can bring anxiety, because you now have to confront, well, what happens now? So that's kind of reflecting on the impact of COVID more broadly. Then to focus in on UK workplaces and workers in particular, at Mind we commissioned a literature review recently to look at all the data and insight that we have around the impact of COVID on employee wellbeing, and by extension, what employers have been doing in response to support their staff. So I'm just going to share some of those key themes. I will flag that a lot of the data is from spring and summer of last year. So a bit of a knowledge gap in terms of what has the last period of a national lockdown done to people, the impact of festivities over Christmas being restricted, etc. But in terms of key themes, we know that the impact of the pandemic on employers has been almost universal. Nearly every employer has been having to deal with furloughing staff, remote working at scale, dealing with the unknown fallout of what it will mean for their business or their organisation. I've already flagged that pressures are being felt most acutely by women, but of course key workers, and this is a range of jobs. So this is frontline workers, so NHS, social care, emergency workers, but key workers more broadly are of course educators, retail staff, and anyone else that was kind of leaving their home at the height of the pandemic, a place of safety to keep essential public services running. So we know that key workers compared to non-key workers are reporting high levels of being overworked or stressed. Small employers are feeling the pressure of reduced demand for their products or services more acutely than large employers. And if then they're having to furlough staff and support their staff with their mental health who are being furloughed or perhaps working from home or a mixture, that is, of course, an additional pressure for small business owners during this time. We found that furlough is a mixed blessing, of course, for employees to have a continued connection with their workplace is a positive. Obviously, not losing their job, even if they are only at 80% of their wages, is better for them. But of course, for employers, it's difficult to support your staff who are furloughed, who might be experiencing isolation or struggling with a lack of structure. Thinking about another big group of people, and of course I count myself within that and mind more broadly, huge numbers of people are now working from home, and that is a challenge for both employers and employees alike. For employers, making sure people have got the right setup and equipment at home, that they've got policies in place to manage remote working and the working practices to support that, and then also being able to set reasonable expectations for staff. And then of course on the other side of that, we have seen a real rise of people working longer hours, a blurring of boundaries between your working life and your home life. And we've heard of people introducing fake commutes, so they'll finish the working day and go for a walk as a way to get some physical distance from the working day in order to then focus on the evening and their downtime. But it is interesting to think about what does working from home mean for the future. The rise of agile working over recent years has been an increasing trend. Many industries and sectors have always been quite resistant to this, saying it's not possible, but of course we've now seen that it is possible. So just thinking about what that might look like in the future, and whether or not it might be more of a hybrid way of working, and what does that mean, and use of office space and so on. I think the next big theme that came out from the literature review is of course around redundancies, and I think this will be the story of this year. We're already seeing record levels with predictions of 2.6 million of people unemployed by the middle of this year. And again, within that, young people probably bearing the brunt of that because they're in the industries that have been most impacted and will take the longest to recover. And then again, just to reflect on many of the pressures for employers is around the unknowns, and for employees really, in a post-vaccine world, will commuting be safe? If it is safe, will people feel it's safe? Which is another factor, of course. If we've seen such a major pivot by businesses to offer their services online, what does this mean for face-to-face and in-person jobs going forward? And so on. So again, there's a lot that we don't know. I've spoken about these already, but I think it is helpful to reflect on some of the groups within our workplaces who are more at risk. So I've already flagged about frontline workers who have been dealing with extreme pressure and tough conditions and high levels of trauma during this time, and thinking about maybe the more medium to long-term impact of this and how best to support. Key workers more broadly, of course, there's the risk to their personal safety, both in terms of catching the virus or taking it home to their friends and family, but equally we have seen a rise in verbal and physical abuse of retail workers, particularly during this time. So the risk to personal safety is also linked to that. I've already flagged about women managing the financial and psychological impact of juggling home and work. A lot of women have had to reduce hours during this time. People from Black, Asian and minority ethnic communities have also seen a greater loss of life during this time, but also experiencing a greater risk of job loss and financial difficulties linked with that. I've already flagged about business owners and having to bear the brunt of all the financial worries of running a business, as well as then trying to support their staff going through a difficult period. But we do know many small businesses are likely to operate in the industries that have been shut down the majority of this time. And again, freelancers more likely to work in the industries that have been shut down, so creative, music, film and TV. So again, just thinking about those experiences of workers particularly. So in terms of what this means for employers, I think for any number of employers, your internal context and your external context has changed and been disrupted during this time. Have you seen increased demand or have you seen decreased demand during this time? I'm sure for the vast majority, not being able to operate as normal and the impact of that. You might have some staff who are attending a workplace. You may have some staff who are working from home, some that are being furloughed or doing flexible furlough. So of course, then having to manage the impact of that on staff who are working. You may have some staff who are going through change management processes or have just been through one. And indeed, for some employers, I'm sure you have staff in all of those contexts and managing all of that at the same time. So quite challenging for employers in terms of how do you support your staff during this time. I know many of the other speakers across this conference will be talking about the more practical things that you can be doing to support your staff. So I just wanted to finish my presentation just reflecting on some guiding principles that I've been recommending to employers during this time, but equally that I've been modelling myself. I lead a team of 45. We've all been remote since March. So I think first and foremost, thinking about staff wellbeing, this absolutely needs to be the priority, and you need to understand people's individual circumstances. So managers having routine catch-ups and conversations with their team members, asking about their wellbeing, checking that whether or not there's anything that can be done to support them, ways of working, etc. So I think that's really important. But again, if you are managing change within your workplace, again, wellbeing needs to be at the heart of that and good communication linked with that. The next point I would make is just around offering staff clarity as much as possible. So this can be about organisational priorities, team priority, right down to their individual priorities. New policies have had to be developed during this time, so just making sure policies, working practices are as clear as possible for staff and linked to that any processes. And I think it's really important to focus on simplification, especially if people are working remotely or in a hybrid way. We've heard everybody talking about, I've got Outlook to check now, I've got Microsoft Teams, there's Zoom calls, people have set up WhatsApp groups to communicate. So I think just trying to focus on simplification, one-stop shops, trying to house things all together, make things as easy to access for staff and to work with would be really helpful. The third point is about a sense of community. That is such a protective factor in terms of our mental health. And obviously during this time, we've had greater levels of isolation and distance from people. So just thinking about how you can create a sense of community in your workplace, even when you are working remotely or in a hybrid way. But I think this is mainly around, regular updates from senior management, so people are aware of what's happening, but trying to make that two-way dialogue. So having mechanisms for staff to share what's going on for them, what's working for them, what isn't. And then building in moments of social connection. Within my team, we've been doing random coffee initiative where people are buddied up to have a coffee. We've been doing virtual lunches. Obviously, everything needs to be opt-in. Some people don't want to then be still online during their lunch hour. They want a break. But again, just trying to think about how you can build moments of social connection and so people can access that peer support that they would just naturally access if we were all in the same workplace together. Another team at Mind has done 11s, so at 11 a.m. everyone stops work, gets together for a virtual coffee and a catch up. Of course, quizzes, etc. So just trying to think about how you can create that more social side of work that might be lacking during this time. And then the final guiding principle is around being reflective. So often during this time, we've had to spring into action and pivot and change our plans. And I think it's always important to be taking stock, seeing stuff as test and learn, seeking feedback and just reflecting whatever we've had in place over the last couple of months. Is it going to get us through the next couple of months? What do we need to tweak? And as I said, staff voice and experiences needing to be really key within that. And I think, as much as I would recommend that to, a team leader, I think it's also good guiding principles to turn inwards and how you manage yourself during this time. So thinking about your well-being, what are you doing to support that? Thinking about the clarity you need for your role, thinking about the community you have access to and how you can seek support, and then also being reflective about what's working for you, what isn't, how are you doing. I think the best tip I could give anyone during this time is to regularly check in with yourself, give yourself a score between 1 to 10 for your well-being, 1 being not so great, 10 being great. And just depending on your score, thinking about, well, what will take me to the next level? Is it a walk? Is it playing some music to change my focus, to change my energy? So yeah, just trying to think about where you're at and what would be helpful. So I hope that's been useful to kind of give you an overview of some of the key trends and issues and experiences for people more broadly, but obviously within workplaces and workers, and some guiding principles to help you navigate, I guess, some ongoing choppy waters ahead of us over the next couple of months. Thank you.
Thank you, Emma. I think that's given us all food for thought, either as an employer, thinking again about how we encourage that social interaction when we're all working at home, but also as an employee, thinking about where you are on a scale of 1 to 10. And I don't know about you, but I feel that changes on a daily basis, sometimes on an hourly basis. And I think we all do need to keep checking in with ourselves and do what's right for us and look after ourselves during this. So thank you again, Emma. Emma will be back in a live panel after the other speakers to take questions. So do put questions in the chat that you'd like Emma to answer. So now I would just like to welcome Pia, Parminder and Chris from Leeds City Council to talk about their experiences during the COVID pandemic. Thank you.
Everyone, my name's Pia, and Mindy and I are here today to talk about the impact of Covid-19 on health inequalities and staff health and well-being. I'm going to start by giving a little bit of context to what the data tells us, including the Public Health England Disparities Report. All of the evidence is showing that COVID is mirroring and often exacerbating existing health inequalities. Much of the data that I'm going to talk through in this slide, I've sourced from the Office of National Statistics, which has a great website on some of the data that's covering COVID. All of the evidence identifies the same groups as being most adversely impacted. And if we have a look at this, we can see that age is probably the greatest cause of inequality, with hospital admissions and deaths remaining highest in those aged 75 and over. However, there is still significant death in working age adults aged 45 to 64. We also now know that certain clinical or health conditions are also a greater risk when it comes to mortality in COVID. The evidence also identifies that people with a disability or a learning disability are also at greater risk. In this third lockdown, we are now seeing a fall in infection rates, hospital admissions and deaths across all regions. However, it's worth noting that the decrease is not happening at the same rate in all places, and in Yorkshire and Humber, although the decline is steady, it is slower than some other areas in England. Yorkshire and Humber also has a higher antibody positivity rate than the England average. That means that in Yorkshire and Humber, people who are going for a COVID test are more likely to test positive. Like with most health inequalities, COVID is also linked to having higher rates in areas that are ranked as most deprived. So our inner city areas tend to have higher rates of COVID as well as higher mortality rates. In Yorkshire and Humber, there is also higher positivity rates within our Black, Asian and minority ethnic communities. And the data also shows us that most ethnic minority groups have higher mortality rates for COVID compared to white ethnic groups. This disparity is highest among Black African, Bangladeshi, Black Caribbean and Pakistani people, and is highest among Black African men, where the rate is 2.7 times higher than men from white ethnic groups. And this is highest in Black African men, where the rate is 2.7 times higher than men from white ethnic backgrounds. There is also a strong link between ethnicity and occupation, and a study by the University of Manchester in January this year found that Black and Asian staff represent 21% of the NHS workforce, but accounted for 63% of death amongst health and social care workers during the first wave of the pandemic. When we start to look at occupation, it's worth noting that although current rates are going down, the rates remain highest in working age adults aged between 35 and 49. When we look at occupations, we can see that deaths are highest for men and women, in particular particularly in caring, leisure and other service occupations where there is a lot of contact, often close contact with other people. It's also high in elementary occupations such as cleaners and in factory settings. Similarly to the Manchester study, the ONS data shows that Black and Asian men are more likely to work in occupations at higher risk of COVID, for example in transport, security and cleaning jobs. We also know that there is a relatively high proportion of women working as care and home workers who are from Black and other minority ethnic backgrounds. Again, emphasising that link between not only where people live, but also their occupation and ethnicity. The vulnerability triangle helps us to look at some of this intersectionality in a little bit more detail. And it's a useful model because it's not static, but it helps to capture where a person is in a certain moment in time, whilst recognising that people change and their circumstances change through the life course. And it enables to look at how that intersectionality impacts on access, experience and outcomes. Who I am relates to demographic factors like age, ethnicity, if you have a disability, if you're married, if you have a long-term condition. In terms of COVID, we've already identified that age and ethnicities are factors that can increase your vulnerability, as well as certain health conditions. And if, for example, you look at the evidence around some of that intersectionality, even within who I am, for example, people of South Asian background have a higher prevalence of cardiovascular disease and diabetes, which is associated with an increased risk of COVID. In terms of where I live and work, we know there's increased susceptibility from living in inner city areas where living conditions and environments are often poorer, with, for example, higher air pollution and more congested traffic. As stated earlier, we also know that there is a higher proportion of people from Black, Asian and ethnic minority backgrounds that live in our inner city areas that are ranked as more deprived. And there is more limited access to green space and private gardens. There is also an increased risk of transmissions in these areas due to the densely populated housing available, such as high-rise flats and back-to-back terraces, and more multi-occupation accommodation. This type of housing makes social distancing and self-isolating much harder. We also know that multi-generational households that include someone over the age of 70, as well as other younger people, is more common in households of Bangladeshi and Pakistani backgrounds. And again, as said, this creates particularly challenges for those who may need to shield and when people need to self-isolate. I've already talked a little bit about the increased risks of certain occupations, and the increased exposure due to work is higher for people in lower income jobs who are less likely to have the option to work from home and who are more likely to use public transport to get to work, increasing their exposure to COVID. ONS states that at the moment, over 40% of people who are working are travelling to work either exclusively or as a combination of working from home. And this is probably a massive increase to the number of people that were travelling to work in the first lockdown. Finally, we can't underestimate how important how you're treated impacts on your health and well-being and your access to services. Mindy will talk about this a little bit more in a minute, but you can't underestimate the impact of stereotyping and discrimination, both individual and institutional, on people during the pandemic. And there is evidence to suggest that access to testing and vaccines and confidence in accessing these has been lower among some of our Black, Asian and minority ethnic communities. A further example of this was highlighted in An Avoidable Crisis, which was the review carried out by Baroness Lawrence into the disproportionate impact on BAME communities of COVID. In this, it stated that Liberty found that police forces in England and Wales are up to 7 times more likely to fine BAME people for violating lockdown rules than people from a white background. We can see from the vulnerability triangle that some of our Black, Asian and minority communities are vulnerable on all 3 sides of the triangle, having identified ethnicity as one of the key groups at risk, as well as certain conditions that are higher in those communities, a higher proportion of our Black, Asian and minority communities living in some of our inner city areas that are experiencing higher rates and mortality, as well as working in higher risk occupations. In addition to this, there is increased links to discrimination and stereotyping through the pandemic. I'm now going to hand over to Mindy, who will talk a little bit more about how discrimination has impacted on people's health and well-being and some of the wider factors that are also having an impact. Thank you.
So racism has played a huge role in how people from BAME backgrounds have experienced the pandemic. So if you take a look at structural racism, we explain this as policies and processes embedded in society that disadvantage BAME communities. So Public Health England released its first report in June 2020 into the disproportionate impact of Covid-19 on BAME groups and consulted 4,000 stakeholders. So they reported on the experience of racism and explained that BAME workers were less likely to demand protective equipment and were less likely to seek care due to a historical lack of trust between patients and the NHS and also prior negative experiences. And it's interesting to see that the word racism featured 24 times in the 69-page document. Some further evidence is being produced by the Trade Union Congress, and they reported that workers of colour lost their jobs and had their hours reduced twice as quickly as white workers in 2020. Looking at institutional racism and attitudes and behaviours, we can look at how the media and journalism has covered events during COVID. And at times, I think you can agree that it's often perpetuated and fueled racism. Take, for example, how Chinese people were being branded as dangerous and blamed for the outbreak. And at another level, South Asian communities were being blamed for the spread of coronavirus, and racial tensions heightened between communities in some areas, such as Leicester and Blackburn. Moving to look at the socio-economic impacts of COVID, working in a different way has brought some positives and negatives for people. Some people have enjoyed working from home because it's cut out that commute from travelling to and from work. But at the same time, it's left people feeling isolated and despondent. There's also the fast-paced nature of working from home, and it's created this pressure that makes us feel like we have to be available to our colleagues and partners all the time because you're online. And we've lost that time that we would usually spend travelling, so it's reduced the opportunity to de-stress and shift from a working mind to the home setting. Women are also being shown to be impacted heavier than men in terms of employment, and this is mainly because of the sectors they may work in, including hospitality and retail. Globally, women's job losses during the pandemic are reported to be 1.8 times greater than men's, and that's not just explained by people being laid off. Women have reported employer inflexibility and caring responsibilities due to the closing of schools has created stress. Looking at crime levels, so people being forced to stay at home under government rules has resulted in increased crime levels for domestic-related abuse. And this was reported by the Office for National Statistics in August 2020. We've also seen hate crime statistics within East Asian communities rise, and this was due to unfounded prejudices surrounding COVID and its origins. So employment is one of the most strongly evidenced determinants of mental health. The Institute for Fiscal Studies highlights that the economic repercussions of the crisis are falling disproportionately on young workers, low-income families and women. For some, the pandemic has prompted people to take early retirement and redundancy, and others are reporting loss of days' work due to sick leave, and we are seeing increased debt. So looking at the situation regarding food insecurity, we're seeing a larger number of people relying on food banks, and the Food Foundation reported on the results of a YouGov survey, which found that more than 3 million people reported going hungry in the first 3 weeks of the UK's first lockdown. So people's experience of mental health is dependent on their social and economic context in society. Looking at a national level, the Mental Health Foundation has consulted more than 4,000 adults to shed light on people's emotional responses to the pandemic. As of the end of June, 1 in 10 people in the UK reported having had suicidal thoughts or feelings in the past 2 weeks, and there are even higher proportions of people from certain disadvantaged groups. Moving to look at what we're seeing in Leeds, Health Watch Leeds has carried out some insight work and came up with some top themes. So the first one was looking at access to services, and this was considered to be compromised due to limited digital literacy and a fear of catching the virus in healthcare settings, and people trying to manage pre-existing conditions without guidance from professionals. There were ongoing fears of the pandemic, including worries about leaving the house and a perception that others were not following guidance. In terms of work and money, threat of debt and unemployment, feelings of isolation and demotivation from home workers, difficulty in combining home working and school working, and ongoing stress and anxiety of frontline workers were reported. In terms of families, carers and young people, there was overwhelming isolation during lockdown, and this raised concerns for isolated family members, including those in care homes. Carers appear to have picked up the slack when services have been withdrawn and have been on duty 24/7. And fears of loved ones dying without being able to say goodbye have been overwhelming, and family relationships have been put under strain. And some young people have struggled with the lack of routine and anxiety, and this is most often 16 to 18-year-olds and young adults, and some of this is due to uncertainty around exams and jobs, etc.
We can see from the information Mindy and I have shared that COVID is a live and present issue for both employers and employees. As employers, it's important to look at how we support and keep employees safe and well during the pandemic. I'm now going to highlight a few things that Leeds City Council have done. To ensure staff not able to work from home were safe, we worked on developing both workplace and individual risk assessments. The individual risk assessments were developed closely between our health and safety team and our Black, Asian and minority ethnic staff network in order to ensure that we could address some of the additional concerns, issues and anxieties that were being experienced by our Black, Asian and minority ethnic staff. We also developed regular pulse surveys to identify and look at how our staff were feeling and what support they felt they needed. We've continued with these on a regular basis, and they've helped to inform what our wellbeing and support offer has been. This offer has been quite wide-ranging and has included weekly drop-in sessions for our clinically extremely vulnerable and our clinically vulnerable staff. We've also set up a Covid-19 inquiry support line, which so far has had over 2,000 calls for support. Similarly, our health and safety inquiry line has also had over 1,000 calls so far. As the pandemic has continued, we've also become increasingly aware of the importance of mental health and well-being for staff. Therefore, we have a number of mental health first aiders within the organisation and offer a listening ear and healthy minds. We've also set up How Are You Feeling sessions for both managers and staff, and come and have a cuppa and a chat sessions, as well as mindfulness at work sessions. We've also looked at developing the confidence and knowledge of our wellbeing champions in order to help them support their colleagues and peers around COVID. We also have a 24/7 employee assistance programme. We also have a 24/7 employee assistance programme, which gives our staff 24-hour access to a self-referral counselling service to discuss a number of issues that they may have concerns around, including work or personal life, children going back to school, financial worries, etc. Our support offer is promoted regularly through our intranet site, our weekly manager updates, as well as our Be Well bulletin. And as I've said, this is regularly reviewed.
In October 2020, the West Yorkshire and Harrogate Health and Care Partnership launched its report, Tackling Health Inequalities for Black, Asian and Minority Ethnic Communities and Colleagues. The diagram on the screen outlines some of the key recommendations, and just to name a few, there is a call for a focus on the delivery of co-designed ethnically appropriate advice and support for people working in high-risk roles to help mitigate risk to their health, their families and communities. There's a call for equality of opportunity for BAME groups in all economic development and recovery plans, including things like apprenticeships and job creation. There's a focus on the co-production of anti-racism campaigns and recognising that BAME is not just one homogenous group. And there's also a focus on the development of independent discrimination panels with BAME representation in disciplinary and complaints cases. I think it's a really useful resource, and please do look at the full set of recommendations. And I really think it will be a good aid for employers in helping make the workplace a more equitable and inclusive environment for all staff.
Thank you for listening to our presentation. We hope you have found it interesting and useful, and we'll be around for the Q&A session if there are any questions.
Thank you. I think that was a stark reminder to us all about the inequalities that this pandemic has created. And unless we all start to work together, actually it's going to continue long after the pandemic, and we really need to do something about that. A reminder to everybody to please do ask questions. All our speakers will be live in a Q&A session after our next speaker, who is Emily from Women's Lives Leeds, who is going to talk to us again about the experience of women during this pandemic. Thank you, Emily.
Hello, and thank you for inviting me to the Wellbeing at Work 2021 Covid-19 and Beyond conference. My name is Emily Turner. I work for Women's Lives Leeds, and we're a consortium of 12 women's organisations. And today I'm going to present to you about Covid-19 work and mental health, an unequal landscape, a gendered perspective. How has the pandemic shone a light on women's inequalities? So I run the Women Friendly Leeds movement. It's a movement for Leeds to become the first UK women friendly city, and it's a UN initiative. There isn't many women-friendly cities in the world, none in the UK and not a lot in Western Europe. So we aim to be the first. And with that, make Leeds a more equal, fulfilling, safer and healthier place for women and girls. So in June of 2020, we conducted the Covid-19 Women's Survey. And this was a survey that aimed to learn about what women in Leeds thought and their experiences about the disproportionate effects of the pandemic on women. It was at a time when the first lockdown had happened and women were sort of able to look back and reflect over that. And we asked them questions about, like I said, about their opinions and also about their experiences. And some of the things that we learned that I'm going to share with you today are on this slide. So 85% of respondents agreed that women were bearing the brunt of childcare and other caring responsibilities more than men. Work, employment and jobs was actually the top concern regarding the pandemic when they were thinking about the future. 56% agreed that they'd experienced mental health issues more than normal directly due to the pandemic. And we found that although they said that it wasn't a women's issue particularly, that statistic shows us that it was a big concern for women. In fact, mental health was the top fourth concern for women around the pandemic in that moment at June 2020. And when we asked in what ways did women think they were disproportionately affected by Covid-19, the 5 top answers were: firstly, employability; second, childcare or homeschooling; thirdly, carrying emotional burdens or juggling lots of multiple roles; fourth, increased amounts of household chores; and the fifth, other caring responsibilities outside of their own children. So what did we learn through talking to women throughout the pandemic and also within our partners and other means? we learned from the survey and from our partners that the pandemic, obviously, it's been difficult for us all. And we know that even though we are in the same storm, we're not necessarily all in the same boat. We've learned about some of the key disproportionate effects that have emerged. Some have even told us that inequality has been pushed back decades. It's been a real issue. For a lot of women, the added stresses and strains of a multitude of additional tasks has been particularly stressful. Women have been working from home while also disproportionately juggling those multiple roles such as homeschooling, childcare, caring for others. Sometimes that's existing caring roles that have become more difficult, or sometimes it's new emerging caring roles that they've taken on. They've been experiencing additional housework, cooking, cleaning, washing, that kind of thing. They've been carrying the emotional burdens of others, spending time checking in with family and friends, for example. Some who've been isolating or shielding, or have simply become more isolated due to the restrictions from the pandemic. There have been concerns relating to being more likely to have been furloughed, lost their jobs. Perhaps they've been in industries where future work is uncertain, such as hospitality or retail, for example. Some have really experienced difficulties coming back to work after maternity leave. And women have been really concerned about how this will affect their employability in the future. How has it been perceived? So, for example, maybe they've been on a Zoom call with a child in the background making a lot of noise, and they've felt that their male counterparts have not had the same experiences. And there's just a few quotes here from the survey just to really highlight what I've been saying. I think that women are suffering professionally. Those with children and working from home can't be as productive as childless colleagues, and some women are having to work longer or later hours to compensate. Is COVID going to be a time that managers think of when promotions or pay rises are available in the future? What is the lingering impact going to be? I'm trying to decide whether to apply for a new job. How is the responsibility of homeschooling? I might not go ahead with my application, even though the vacancy is a good match to my skills. And the third quote, women will lose jobs and give up employment to manage children during the pandemic. Men statistically tend to earn more, and thus women end up stepping back into the home. This brings with it financial issues such as identity stress, and this can present issues when trying to get back into employment, especially if it needs to be part-time, flexible, meet childcare needs. Women are more likely to be unpaid or paid carers, and again, disproportionately affected, having to manage all the struggles of supporting isolated, cared for people. So with this in mind, Women Friendly Leeds as a movement is launching our new campaign, given all the evidence and the information that we've collected from women over this time. And the campaign's called Shining a Light on Women's Inequalities. This is our normal. And I've just picked 2 out of our 4 key messages to share with you that relate to employment and mental health and well-being. Our first message, we have the right to equal employment options. We want to make our normal. So this is shining the light on the reality of equal employment options for women and girls in Leeds. And the second is about our well-being needs better support. So shining a light on the lives of women and girls in Leeds and the support that they need. And that is very much linked to employment. And we found that when we've been talking about mental health and well-being, it's about all those added stresses that are happening and linking it to how things are at work. So we're saying we'd like a better normal. So actually, during the pandemic, we've proved that employers can support flexible working practices. They've supported people through the pandemic to work more flexible hours, for example. So we should look at these practices to make new norms for working that appreciate some women's circumstances and make it more acceptable and not unusual that women can job share, work flexible hours, and have visible elements of all they are juggling in their life and address the stigma attached to this. I'll give you an example from my own personal experience. In the first lockdown, I had 2 children at home. One was 12, one was 2 at the time, and the 2-year-old needed constant looking after. The 12-year-old was, in his first year of high school, trying to navigate learning from home. And I had 3 roles. I had the role as a homeschooler, I had the role of a carer for a 2-year-old, and I had my full-time job at the same time. And each one of those elements had my focus at any one time, which meant that the other 2 didn't. And that was the most stressful, difficult time. Looking back, I don't quite know how I managed it. And sometimes I would be in a Zoom call or an international conference, for example, and the 2-year-old would be in his nappy climbing over my head or some such thing. It was very real and very difficult to navigate. What kinds of things can employers do? All sorts of things. They could make top jobs available as job shares, have a full statement about how flexible working practices are adopted on their job adverts or on application forms for jobs. They can update policies to state that they recognise and have actions that promote equality. They can appoint maybe a mental health or wellbeing advocate available for employers to voice concerns and access support. How about a wellbeing day once a year, or maybe an hour a month for all employees? Could wellbeing packs or guides be provided for new employers at induction or recirculated to employers yearly? Could you create groups or spaces for women to meet and talk to reduce isolation, connect people, improve well-being? And lastly, could you join the Women Friendly Leeds campaign? Could you make a pledge with us and promote what you're doing using our digital badges on your website? We would very much support anybody, any employer or any employee, to look at things that they can do within the workplace to address these inequalities that we now know women have been facing and have been experiencing. So I'll leave it there and just thank you very much for listening. It's been great, and I'd love to answer any questions should you have them. Thank you very much.
Thank you, Emily. That was really interesting. Actually, at Leeds Mind, we do have a wellbeing hour that we offer to all staff every month, and we get really positive feedback about that. People can do whatever they want with that time, whether it's having an extra hour in bed, in different times, meeting a friend for a coffee, going out for a walk. But we do really promote that, and certainly over the pandemic we've been encouraging everybody to ensure that they take their wellbeing hour every month as just additional time for themselves. So thank you to all our speakers. We're now going to welcome back those speakers to do a live Q&A session with us. Now, this is the first time I've ever managed this on a virtual platform, so you might have to bear with us, but please do ask any questions that you want, and we will address them to the most appropriate speaker. So if I could welcome back all the panelists, that would be great. Thank you. Hi, thank you all very much. I don't know if you want to, I suppose you don't need to introduce yourselves, do you? Jeff is actually from Leeds City Council, who I don't think spoke on the screen, but is available to take any questions. So I suppose one question, sorry, just before I start, I think a lot of people have been putting in the chat ways in which they've approached the pandemic and what has worked for them, which has actually been really helpful. So if you could continue to do that as well, because again, that's what we're here for, is actually to share experiences. One of the questions I think that came in earlier on was for Emma, around whether you could share the impact reports that you referred to, Emma.
Absolutely. So the data I shared from Mind's Covid19 survey from April of May of last year is publicly available. So I'm very happy to share a link to that. In some of the other research studies that I was citing, those aren't, we haven't published a literature review bringing that all together, but I can pull out the key ones that I mentioned and very happily share that with you, or the conference organisers, to cascade to attendees.
Thank you very much. And then I think a question for the Leeds City Council employees around really how we start those conversations with staff from different ethnic minority groups without making assumptions, and how I suppose how we really start those difficult conversations.
So
I think I might hand over to Jeff to talk a little bit more about this, but in the council during the pandemic there's been really close working with the Black, Asian and Minority Ethnic Staff Network to try and make sure that we are listening and trying to respond accordingly. Now I think Jeff may have been a little bit more actively involved in that work.
Yeah, I can just capitalize on that one a bit more. Yeah, so there's been loads of work with our BAME staff network. So we have a number of different staff networks, and one of them is specific to the BAME community. So we've done a lot of work, in terms of addressing some of the anxieties that have come from that network group, and we've worked really closely with them to put together a specific risk assessment for those that we felt were more vulnerable to the Covid-19 infection. So that risk assessment took them through, various aspects of how they work, who they work with, and then looking at other controls that we could put in place with the management and the service to address those concerns and obviously alleviate any sort of risk or further risk of infection to those particular team members. So that's worked really well, and everyone involved with that, I think it was a really good piece of work. And trade unions as well were heavily involved.
Can I just add to that, Jeff? It's just to recognise that everybody individual should be their concerns should be addressed individually. It's not about lumping people into groups, and kind of trying to develop solutions homogeneously. Yeah. So just to say that we have been doing that.
Yeah. I think the template for them to use obviously was a generic template, but it those individual conversations that managers have with the staff members, and then we had further support through our occupational health and human resources section as well to sort of iron out some of those sort of more complex issues that some of our staff are facing.
And I think maybe just to add to that as well, I think the pandemic has obviously led to that piece of work around the risk assessment, but it's also helped to act as a catalyst for a greater discussion between that network and the senior leadership team within the council, and has resulted in an action plan to kind of look at how we work more closely with staff as we move out of the pandemic as well, in addressing some of those kind of ongoing inequalities.
Yeah, thank you for that. I think that's helpful, and I suppose a similar questions come up for Emily, really, around also having those conversations with women, and how, because sometimes that could be difficult conversations or quite triggering conversations. So I suppose any tips you've got around that, Emily?
Well, in actual fact, I do think that women want to say about what their experiences have been like. They really want to highlight that it's been really difficult. They've been juggling all those multiple roles, and they do worry about their futures, about gender inequality reversing itself, and about how and the things that we can do to make all that better. So in my experience, women are wanting to talk about how the pandemic has affected them to make it better for the future.
A follow-up question to that, I suppose, just come up, which may be relevant to either Emily or Emma, really, as to how we can make job share more the norm going forward. I don't know if you want to pick that up first, Emma, and then if Emily, you want to add anything to it.
Yeah, absolutely. I think we have seen challenges around this, and I think it's also then reflected in terms of senior roles and who occupies those roles, and then can then inform, organisational policies and offer more flexible working. So I think with the pandemic and everything that's happened, if we could think about how we transition forward out of this and take the best of what we've learned and the changes that we've had to just quickly adopt, as I said about remote working, the future of work, but I think also just looking at some of these challenges that maybe we've just accepted for many years, and this has been such a massive disruption. It would be a lost opportunity to now not think about it as an opportunity for a reset and a way to build back better, and to look at what some of these challenges have been and how we can think about how we create more mentally healthy workplaces, more inclusive workplaces, more family-friendly workplaces, more gender equality, and so on. So I am actually quite hopeful once we transition out of what is still quite a difficult period and a lot of unknowns, that we can take some of this learning and really build workplaces that are future proofed and much more reflective of the society and the way we live and work and want to live and work in the future.
Yeah, and to add to that, I think there has been an awful lot of fantastic stuff going on, but we need to make that much more visible so we can see it. So why aren't we saying on our job adverts, we are going to be, you know, we will accept job share? Some do, some don't even mention it or think about it. And same with flexible working practices. That needs to be really visible everywhere so that the good practice can shine through, because it is there. So we're not saying that these things aren't happening. We're saying we can't really see them very well. There's no reason, it doesn't seem to be any reason why job sharing, as one example, but there are many, can't happen. So we need to look at why people are saying they can't do it, if that's what they're saying, and unpick that, because I haven't seen particularly why that wouldn't be possible. So, yeah.
No, thank you for that. A question for the Leeds City Council employees. Is there an online risk assessment that people can access?
I can answer that one. We have online risk assessments templates on our insight pages. But I suppose if anyone external to Leeds City Council wanted a copy of ours, then, you know, none of those are confidential or anything like that. So we'd be, you know, welcome to share those. So we have three different types really. We have the a generic COVID risk assessment that services would utilise when resuming or expanding services. Then we have the task-based risk assessments, and also we have the COVID secure checklist for when we were reopening our buildings and our sites to make sure those were safe. And then I think the individual risk assessments that I talked about earlier, you know, for those staff that are more vulnerable of COVID, then we have those as well. So those are all available on our insight pages, but we can obviously share those as required as well.
Thank you. No, I think that would be really helpful. A question for Emily, I suppose. Do you think the murder of Sarah Everard last week and I'm sorry, that's my dog now barking in the background. I do apologise. Do you think that will have an impact on, you know, the experience on women's mental health again? Really.
Absolutely, yeah. Of course it will, and it's a very difficult conversation on lots of levels, because it is around women's safety. Of course, it's about women being able to speak out as well. So it's got that element of women's voices being heard, and it's also about kind of putting the impact on men instead of women. Women shouldn't be wearing this, shouldn't be doing this, shouldn't be out and about at this time. Removing, you know, taking away from those conversations which have been had before, and putting it onto men, like why are men attacking, and working on that. So of course it has a massive impact. It has an extra special impact because of the way that women haven't been able to go out and reclaim the streets and do their vigils and their walks because of the pandemic. So it's had a kind of added stress, but of course, and it's something that we at Women Friendly Leeds are absolutely going to address and want to take forward in our campaign going forward to look at this issue. It's come about now for this specific reason, but it's something that's been about for a long time. So yes, sadly.
Yeah, I don't know if you wanted to add anything to that, Emma.
Well, I mean, at the start of the pandemic, obviously, we saw the huge rise in domestic violence and people in their home conditions and not being able to escape some, you know, difficult, challenging circumstances, situations, physical safety as well. And then employers needing to respond to that where they could and offer support in how they could. And I think then the events of last week, I think, have then shone a light again about women's safety and what that means and the trauma experienced for people living in those situations, how they will connect with that, but then just more broadly for women thinking about their safety. So yes, I think Mind is looking at its response around that and how to support women's mental health in either living in those circumstances or connecting with that and feeling concerned about themselves. So yes, I would agree.
Thank you. And I suppose as we just draw this session to a close, I wonder if there's a top tip that you've all got that we can all take away. I mean, I've certainly learned a huge amount this morning, but if there's one thing that either as employees or employers we could all be thinking about as we move forward. Difficult question. I put you on the spot.
I could share one. I think the important one for me is lots and lots of communication and consultation with the workforce, and address those anxieties at a really early stage, so that you could, look at getting the support in place and getting those discussions, and then it makes it much better when staff are returning to the workplace, and ensuring that obviously those workplaces are fully COVID secure.
Shall I go next? I mean, I had loads of top tips in my presentation. Yeah. So look at all the things that you can do, those little changes that you can make, which are actually quite easy. They're not big, complicated things to do, and make them visible so that people can see them as well as you actually putting them into place. So things like flexible working practices, offering job shares for especially top roles within organisations, to address those kind of women's having those top jobs. So do as many things as possible. Join the Women Friendly Leeds movement, of course, become an ambassador, make a pledge, make it visible, and make those things that you're doing visible.
I don't mind going next. So a call to employers to kind of treat people as individuals and listen to people's experiences and concerns, and not make any assumptions kind of what people's experiences are based on things like their age, their gender, their ethnicity. Really take that time to listen and offer the support appropriately.
Thank you.
Shall I go next? Oh, Pia, did you want to go?
Yeah.
No, sorry, it's okay. You can go, Emma.
No, I was just reflecting on what we've been talking about, some of the positives from the pandemic, and I will say it has accelerated conversations about mental health. And I think because we've all been seeing into each other's living rooms or wherever our working office spaces, I think there's been a rise of compassionate leadership and line managers sharing their vulnerabilities and creating the space for people to share how they're doing. And I think, just linked to what Mindy was just saying, just everybody to be treated as an individual, everyone to be respected for valuing diversity, respecting what everybody brings to the workplace, and just seeing that sense of community. I think it would be important to kind of retain that as we move forward.
I think that my bit was going to be very similar to Emma and Mindy, really. No, it's fine. And just to really to reiterate what Tom said right at the beginning around the importance of being kind to each other and ourselves during very difficult times. And I think you're right that managers have a really crucial opportunity to listen to what people need and to be there, and that connection's really important.
Yeah, thank you. And I suppose that links into the very last question that we've had, which is how we actually engage our workforce or consult with our workforce about what the workplace looks like going forward. And I don't know if any of you have got any tips on how you're doing that or how you're doing it well.
I think one of the what we did with one of our large office blocks, we did some virtual tours, so that we had member staff talking to other staff members about how the office was set up and the safety precautions that were taking place. And as part of that virtual tour, people could sort of visualise what the office looked like and what they were going back into in terms of the different changes in terms of the social distancing and signage and those sort of things. So I think that was quite a useful exercise.
Thank you. I don't know if anybody else wants to add to that.
I would just say what we've been recommending during this time, that asking staff either at a team level, organisational level, to feedback on working practices, what they'd like to retain, what needs to be streamlined going forward, what hasn't been working so well, and then thinking about how you build that that workplace, that return, and those ways of working. I think there is obviously the physical side of work, but it's also how work is managed. And if you're going to be working in a hybrid way, I think we've seen a lot of people indicating they want to do 3 days in the office, 2 days home. Just thinking about how you're actually going to work, because it's quite easy when everybody's quite binary, everyone in the workplace, everybody at home, and blended is quite challenging. So yes, I think staff voice and co-producing that and co-designing it will be really important, and then reflecting, because it's not going to go how we want it to. It is going to be test and learn.
Yeah, I think that's certainly a process that we're just starting at Leeds Mind. So yeah, if you ask me in a month how that's going, I'll be more able to reply. But I think, yeah, the importance of actually co-producing that, I think, is critical, because it shouldn't be a top level down decision. And I think, actually trying to meet the needs of everybody and get the ideal solution is what we're all aiming for, and taking with us the best bits that we've learned from the pandemic, and being able to, hopefully move forward in a better way and, as I say, build back better. Okay, well, thank you so much to all our panel members. It's all that I've learned so much already this morning, so and hopefully everybody else has too. Thank you again for your time. We are going to take a break now till 12 o'clock, when we will be hearing from Michelle again, and so I'm looking forward to that. So please take a break now and be back at 12 o'clock. Thank you very much indeed, everybody, and thank you again to all our speakers this morning.